Now we're going to talk about the anatomy of the skeletal system. We're going to start with the cranium. So two types of bones in the cranium: cranial bones and facial bones. Cranial bones protect the brain. It's also the site of attachment for the muscles that move the head and the neck. The vault where the brain is called a calvaria. And you can see that the cranium base, basically the part of the skull that supports the brain from the bottom, has three depressions, three fossae: anterior, middle, and posterior cranial fossa. The facial bones form the framework of the face. There are cavities for special sense organs like eyes, and there are multiple foramen, canals, and fissures that form the passages for the nerves and the blood vessels. Muscles of facial expression are attached to the facial bones. So four different types of bones that form cranium, the flat bones here. First one is frontal bone, parietal bone, occipital bone, and temporal bone. Parietal bones here and here are separated from the frontal bone by the coronal suture, and the sagittal suture separates two parietal bones from each other. Parietal bones are separated from the occipital bone by lambdoid suture, and parietal bones are separated from temporal bones by the squamous suture. If we look closer at the openings at the bottom of the skull, we can see some really distinct structures. So first of all, a gigantic opening here and here called foramen magnum. That's where the brainstem / spinal cord is passing through. Jugular vein passes through jugular foramen, and carotid artery passes through the carotid canal. This structures called occipital condyles articulate with the corresponding articular surfaces on the first cervical vertebrae, and you can see very clearly a couple of characteristic processes on the temporal bone: styloid and mastoid process. You can see them quite clearly, at least you can see mastoid process right over here. So these processes, mastoid process and styloid process, which on this picture cannot be seen since it's behind the mandible. Mastoid and styloid processes are sites of attachment for the muscles. Mastoid process is the site of attachment for sternocleidomastoid muscle, longissimus capitis and splenius capitis, muscles that move your neck, while styloid process is site of attachment for deep muscles of the neck that move the food, which is in your pharynx, and move your tongue. Two beautiful irregular bones that are located deep inside of our skull are sphenoid bone and ethmoid bone. You can see sphenoid bone here on the right, so-called keystone bone. It means that it articulates with all other cranial, not facial, cranial bones. In hypophyseal fossa, the pituitary gland resides there, and there are three distinct sets of processes that articulate with other cranial bones: processes of a sphenoid bone, pterygoid process, lesser wing, and the greater wing. Now, ethmoid bone is the deepest bone in the skull, its cribriform plate forms the roof of the nasal cavity, and you can kind of see the little openings. That's where the filaments of olfactory nerves go through to the olfactory bulb. Perpendicular plate here forms the part of the nasal septum, and crista galli, the ridge here, is the site of attachment for dura mater that serves in this condition as a partition for the brain. Two large bones that form your jaws, well, actually three bones that form your jaws. Mandible, it's the largest facial bone, forms temporomandibular joint, so this joint is between the mandible and the temporal bone. It's the only freely movable joint in the skull, freely movable bone in the skull. So condylar process of the mandible articulates with the mandibular fossa, the temporal bone forming the joint. Coronoid process of the mandible articulates with a zygomatic bone, and that is your lower jaw, the mandible. The upper jaw is maxilla. It is fused in the middle, fused in the center, right about here. So originally it's two bones. And your teeth are separated by the alveolar processes, both in the maxilla and in the mandible. They're not shown here, but basically, so if that's the tooth, that's alveolar processes. Palatine bone, relatively small bone, shown here. It's the posterior third of the bony hard palate. Palatine bone does not fuse. It leaves the cleft palate in the newborn. Zygomatic bone, it's your cheekbone basically. Nasal bone forms the bridge of the nose. Lacrimal bone, very small bone right here. That's where the lacrimal fossa is. The lacrimal duct lies in the lacrimal fossa. Vomer is a plate-shaped bone which forms the bottom, the inferior part of the nasal septum. And this bone, inferior nasal conchae, is the part of the lateral walls of the nasal cavity. Now a few more structures in the skull. Orbits. Orbits are formed by 7 different bones. You don't need to memorize them all. So this is the orbit. You can see how many bones contribute to the formation of the orbit. Certain structures inside. So you can see the sphenoid bone, which contains superior orbital fissure. Cranial nerves are passing through it, and blood vessels. Optic canal. So that's the cranial nerve 2. I mistakenly put cranial nerve 1. It's of course cranial nerve. That's optic nerve and ophthalmic artery. Now that's we can take a closer look. So you see superior orbital fissure, optic canal right here. And then you have cavities in your skull called sinuses, maxillary, frontal, ethmoid air cells, and sphenoid sinuses. These are air-filled space that are connected to your nasal cavity, lined with mucosa from the inside. They make your skull lighter, enhance the sound of your voice, providing the resonance. They warm the air, humidify the air, and if they are clogged with mucus, we call this inflammation of sinuses sinusitis. In sinusitis, Basically, the pressure in the sinuses becomes lower than the pressure outside of the skull, and that causes significant pain in those clogged sinuses. Now, the last bone that I want to mention here, it's not really cranial bone. It's a hyoid bone. That's the only bone in the human body that does not articulate directly with any other bone. It provides the base for the tongue. Muscles for swallowing and speech are attached to the hyoid bone. Vertebral column. The function of vertebral column is to support the weight of the trunk and transmit it to the lower limbs, to protect the spinal cord, and to provide certain mechanical buffering, mechanical amortization during the vertical moves of the human body. There are 26 vertebrae in the spinal cord. 7 cervical, 12 thoracic, 5 lumbar, and there are it should be 24 major, of course. These are not vertebrae, this sacrum and coccyx. It's 24 vertebrae, sacrum and coccyx. Yes, miscalculated. So there are 4 curvatures. Just like curved shaped spring makes your mattress buffering your weight, kind of that amortization, that support when you sleep, so do curvatures of the spinal cord provide the necessary amortization of the vertical forces, buffering of the vertical forces that act on your body. So cervical and lumbar curvatures, they concave posteriorly, meaning that they are bent back. Like you see, that's concave from the posterior side, while thoracic and sacral curvatures, they convex towards the posterior aspect of the body. If your spinal cord is abnormally curved to the side, like you see on this x-ray and on this schematic, we call it a scoliosis, abnormal lateral curve. In kyphosis, thoracic curvature is exaggerated. It's a hump, okay, like a hunchback. And if lumbar curvature is accentuated, this is called lordosis, sway back. Lordosis is pretty common in pregnant women. It's transient, it's temporary, and once the woman gives birth, lordosis is gone. Vertebrae in the spinal cord are separated by the intervertebral discs. So they have 2 distinct parts. The inner gelatin-like nucleus, which gives the disc compressibility, it can be compressed, and the outer collar called annulus fibrosus, which is composed of the fibrocartilage, which provides this mechanical resilience to the disc. Sometimes, especially during the lateral sliding motions between the vertebrae, which they're not supposed to perform, and weak annulus fibrosus, nucleus pulposus can protrude, creating a hernia, and hernia compresses the spinal nerve. It may lead to the pain and muscle weakness. So the structure of the vertebrae is quite complex. You have a body of the vertebrae, then you have vertebral arch, which consists of the lamina and the pedicle. Vertebral foramen is the opening serving as the canal for the spinal cord. Intervertebral foramen are right here. That's the openings between 2 adjacent vertebrae where spinal nerves leave the spinal cord. Practically each vertebrae has processes, the spinous process, the two transverse processes. You can see superior articular process, and kind of you can see inferior articular processes. So cervical, thoracic, and lumbar vertebrae have distinct structures. So cervical vertebrae are the lightest because they're on top. All they need to support is basically a head. They have an oval shaped body, triangular vertebral foramina. The spinous processes are bifid, except for the vertebra number 7. And in each transverse process, you can see transverse foramina. Now, there are two very distinct cervical vertebrae, atlas, C1, and axis, C2. This is atlas. So you see it lacks body. Essentially, atlas lacks body. The lateral masses here articulate with occipital condyles of the occipital bone, and basically the atlas provides the way for you to say yes, to nod. Now, body of atlas essentially migrated to C2 axis in the form of that protrusion or process called dens. This is how atlas and axis articulate. You can see dens sticking out where otherwise would be a body of atlas, and annular ligament provides the link between the atlas and the axis. So axis is C2, and atlas essentially can rotate, can pivot around dens, allowing you to say no. Thoracic vertebrae. So you can see round-ish vertebral foramen, bigger body than in cervical vertebrae. Spinous processes are long and they point down, they point inferiorly, and articulate facets of superior and, well, they should be here, inferior articulate processes, they allow some rotation in the thoracic region. Finally, lumbar vertebrae receive the most of the stress. You can see the body of the lumbar vertebrae is pretty large. Vertebral foramen is closer to triangular, flat spinous process shaped like a hatchet. Articular facets, on the other hand, block the rotation, because the last thing you want to do is to rotate your spine in your lumbar region. We always call this side view of the lumbar vertebrae a moose head. Sacrum is composed of 5 fused vertebrae. It articulates with the 5th lumbar vertebrate sacral promontory, and auricular surfaces are the sites of articulation with ilium of the coxal bones. Sacral foramina, these openings, are the sites for the sacral nerves to leave the spinal cord. Cauda equina of the spinal cord goes through the sacral canal. You can see the opening of the sacral canal and another end at sacral hiatus. So sacral canal entrance is here, exit is here. The tailbone, or the coccyx, several fused vertebrae. It varies from individual to individual, and it articulates here superiorly with the sacrum. Thoracic cage consists of the vertebrae, sorry, not vertebrae, what am I saying? Consists of the ribs, sternum, and costal cartilage, and of course, vertebrae in the back. So the function of the thoracic cage is to protect the organs of the thoracic cavity, such as lungs and the heart. It supports the pectoral girdle, supports limbs, and multiple muscles attach to the bones of the thoracic cage. Sternum. 3 bones that are fused: manubrium, body of sternum, and xiphoid process. So this little indentation at the manubrium is called a jugular notch, and the ridge across the front of the sternum here is called a sternal angle. Siphisternal joint is where the sternum and the xiphoid process fuse. Xiphoid process, interestingly enough, is the last bone in the human body that ossifies. Ribs. There are 12 pairs. Males and females have the same number of ribs, whatever Bible says. Posteriorly, ribs attach to thoracic vertebrae. Anteriorly, they form synchondrosis with the sternum. They attach to the costal cartilage directly to the sternum, some of them. So first to 7, these ribs here, these are called true ribs or vertebrosternal. Vertebrosternal comes from the fact that the head of the rib here articulates with the vertebrae, and the tail of the rib articulates with the sternum. Yes, the head is right here, and the tail is right here. 8 to 12 are false ribs. 8 through 10, these ones, are sometimes referred to as vertebrochondral ribs, meaning that the head still articulate with the vertebrae. With the tails, they are attached to the sternum rather indirectly through the costal cartilage, which in turn attaches to the sternum. And finally, 2 vertebral ribs, 11 and 12, shown here. Those are floating ribs. They are attached only to the vertebrae, and there is no attachment to the sternum. So that concludes our conversation about the appendicular skeleton, axial skeleton, and we start to talk about the appendicular skeleton. So first we're going to talk about pectoral girdle. It consists of 2 clavicles and 2 scapulae, which attach the upper limbs to the axial skeleton. The clavicle has 2 distinct ends: the cone-shaped sternal end that articulates with the sternum, and the flat-shaped acromial end, which articulates with the acromion or acromial process of the scapula. Scapulae, shown in these 2 images, 3 borders. So you have lateral border, medial border, and superior border, and angles: lateral, superior, and inferior angles. You can clearly see the spine. Spine marks the site of attachment for various rotator cuff muscles. There are 2 processes: posterior acromial and anterior coracoid process, and 3 fossae: infraspinous, under the spine; supraspinous, above the spine. You can more kind of, not really clear, but supraspinous anyway; and subscapular, shown here. So the glenoid cavity articulates with the humerus. The arm, you can identify 30 bones. The upper arm is the single bone called humerus, and the forearm, 2 bones, radius and ulna. Your hand consists of carpals, short bones of the wrist, metacarpals, long bones of the palm, and phalanges, which form fingers. So humerus is the largest bone of the upper limb. Its head articulates with the glenoid cavity of the scapula. Greater and lesser tubercles are the sites for the muscle attachment. Capitulum here articulates with the head of the radius, while trochlea articulates with the trochlear notch of ulna. And finally, quite clearly, you can see here olecranon fossa, the depression, the very pointy depression. In this photograph, unfortunately, it would be on the other side. Olecranon fossa articulates with the olecranon or olecranal process of the ulna. So this is ulna. It's the medial bone of the forearm. You can see it right here. It forms a big portion of the elbow joint. So this trochlear notch is what articulates with the trochlea on the humerus. And olecranon or olecranon process articulates with the olecranon fossa of the humerus. Radius is the lateral bone of the arm. The head of the radius is proximal to the wrist, for instance. Its head articulates with the capitulum of humerus and so-called radial notch of the ulna. Ulna and radius are connected to each other by the interosseous membrane. This membrane facilitates the movement of the radius versus ulna when you pronate or supinate your forearm. That brings us to the conversation of the carpal, metacarpal, and phalanges. So carpal bones. That's probably the hardest, so we're going to talk about the proximal row first. We start with scaphoid, then it's lunati, then it's triquetrum, then it's apiciform. So 4 bones. You always start with the scaphoid. It's easier because it's fairly easily identifiable bone. Then we move on to the distal row, which starts same side next to the scaphoid, trapezium, trapezoid, capitati, and hamati right here. So you can kind of help yourself remembering that capitati, this bone, articulates with the 3rd metacarpal. So these bones that form your palm, are metacarpal bones. Fairly easy to remember. They numbered 1 through 5. C1, 2, 3, 4, 5 from the thumb to the pinky. These bones are phalanges, proximal, medial, distal. The only finger that does not have medial phalanx, is the thumb. In the thumb you can find only proximal and distal phalanx. Pelvis. So pelvis, bony pelvis, is formed by 2 coxal bones, sacrum and coccyx. So it attaches lower limbs to the axial skeleton. It's basically pelvic girdle. Transmits the body weight to the limbs, to the legs. Support pelvic organs. 3 fused bones form the coxal bone, ilium. ischium, and pubis. Now, ilium, shown to us kind of roughly here, articulates with a sacrum at sacroiliac joint. Abdominal muscles attached to the iliac crest, and you can clearly see iliac spines, the anterior and posterior iliac spine. Greater sciatic notch is where sciatic nerve is passing through, and the large depression called acetabulum is the site of articulation with the head of the femur. Now, ischium, this posterior part, clearly identifiable ischial spine, and ischial tuberosity, that's the attachment for the muscles that flex your hip. Lesser sciatic notch is the passage for the pudendal nerve. Pubis forms a symphysis with another coxal bone, and it contains a large opening called obturator foramen, which is the passage for multiple muscles, blood vessels, and the obturator nerve. As you can imagine, male and female pelvises look differently. Female pelvis is adapted for bearing a child. The cavity inferior to the brim is shallow, has greater capacity. Male pelvis is less forward tilted, okay, better supports heavier male's body. Cavity is rather narrow but deep. The sacrum in the females is wider but shorter, and sacral curvature in females more accentuated than in males. Also, the subpubic angle in females is much wider than in males. Let's move on to the bones of the leg. Femur. That's the largest and the strongest bone in the human body. In terms of the vertical compression, it can easily resist the force approximating to about 3,000 pounds. Comprises about a quarter of the person's height. Approximately, its head articulates with the acetabulum of the hip, and distally it articulates with the tibia and patella. So muscle attachment can be seen at trochanters. The trochanters can be found only in the femoral bone, greater and lesser trochanter. Intertrochanteric line and intertrochanteric crest all represent other sites for muscle attachment. Epicondyles, lateral and medial, so medial and lateral epicondyle, also represent sites for the muscle attachment. Patellar bone, which is not shown in the photograph, but you can see it here, is a small sesamoid bone that is embedded in the quadriceps tendon. Bones of the lower leg, tibia and fibula. So tibia is the medial bone in the leg. It receives all the weight of the body from the femur and transmits this weight to the foot. And fibula is not a weight-bearing bone. No, that's kind of surprising, but there is no weight is applied to the femur. Femur is the site of muscle attachment. Now we can clearly see two malleoli projections, medial malleolus on the tibia and lateral malleolus on the fibula. Those are, again, the sites of the muscle attachment. Here you can see surfaces of the condyles, medial and lateral condyles of the tibia. These surfaces articulate with the condyles, corresponding condyles of the femur. Now lastly, tarsals, metatarsals, and phalanges. So I'm going to skip the illustrated images here and move on to photographs right away. So those are tarsals. It's a really good picture here. So this is calcaneus. This is talus. This is cuboidal. Way to remember it, calcaneus starts with C, cuboidal starts with C. Now talus articulates with the navicular bone, and navicular bone articulates with three cuneiforms: medial cuneiform, intermediate, and lateral cuneiform bones. Those are tarsal bones. Now these ones are metatarsal bones. They numbered 1 through 5 from hallux or big toe to little toe. And these are of course phalanges. You can see that just like in the hand, there are only 2 phalanges in the big toe, proximal and distal. And there are 3 phalanges in all other toes, proximal, medial, and distal. Now, there are 3 arches in the foot. Lateral and medial longitudinal arches that run like this. And transverse arch. It's actually in the bottom, but that allows the foot to better maintain and bear weight. Again, they work like a spring, sort of like a coil. And these arches are maintained by ligaments, tendons, and foot bones. Now, a few aspects of the fetal skeletal development. So first, at birth, bones of the skulls are connected by several fontanelles, like anterior, posterior, sphenoid, and mastoid fontanelle. These fontanelles are connective tissue membranes. They allow brain to grow. They allow skull to expand. And they also make the birth easier because they allow some movement of the skull bones. Now, the cranium at birth is about a quarter of the body size. And as we grow, the head becomes larger, but our body grows at much faster rate. So proportions of the head to the rest of the body change over time, as you can see from that illustration. Now, in the spine, interestingly enough, there are only 2 primary curvatures, thoracic and sacral. And that makes so that if you put, like if that's a palm, then the baby's back, if you put the baby on the palm, look like this, because there are only 2 curvatures, thoracic and sacral. And those are convex, posteriorly convex. Later, when baby starts to lift the head and stand upright, cervical and lumbar curvatures appear. That ends our conversation about the skeleton.